Hello friends, so let's discuss a case related to the third heart sound. Actually it's an MCQ. So when these very bigger MCQs are there, always read the last line. So here what is the contributing factor which produce the S3 heart sound in these patients, and we have four options: mitral stenosis, aortic regurgitation, atrial septal defect and the left ventricular failure. Which among the following is the right? So let's understand the case as a whole. There is a 65-year-old male present to the emergency department with the complaint of what? Shortness of breath, and there is a bilateral lower extremity edema, right? And the person having the history of hypertension and coronary artery disease also. And during the examination, we find out there was an audible S3 sound was there. So let's discuss what can be the answer in this condition. So S3 is actually physiological sound also. So S1 sound, then S2, and just after the S2 there is a S3 sound also. But physiologically this sound is heard because of what? Because of a faster filling of ventricles. So when the ventricles are rapidly filled up, just after opening of the AV valves, if the ventricles are rapidly filled up, they will produce the S3 sound. And this S3 sound is physiologically also heard in whom? In children, in case of young adults, in athletes it's very much good heard, as well as in case of a pregnancy also this S3 sound is heard. Okay, fine, but what are the pathological condition in which there will be audible S3 sound? So we all must understand there are some ventricular defects are there. There is a poor systolic function, means the ventricles are not able to pump the blood very properly. There may be possible left ventricular failure. There is a high feeling pressure because of if the ventricles are filled up, they are having already the blood is there inside the ventricle. So pressure to fill the ventricles will be increased, and if the pressure will be increased to fill the ventricle, it will also result into the louder, or you can say S3 sounds will be there. Okay, fine. So ischemic heart disease, idiopathic dilated cardiomyopathy. So these are the conditions in which there is a high filling pressure of the ventricle, which will result into the S3 sound. There are other conditions like hyperkinetic states, in which also S3 is heard. What are the hyperkinetic states in which the S3 heard? Then the commonest condition is the anemia. Because into the anemia, the oxygen carrying capacity of the blood is less, the tissue demands the oxygen more, so the blood is flowing very rapidly, and it will also produce the S3 sound. Thyrotoxicosis, in which the thyroid hormone levels are high, or high metabolic rates, and which will result into the high hyperdynamic states. AV fistula and the left to right shunt. In case of the VSD, in case of the ASD, the blood is flowing from to the left to the right, which will also produce the S3 sound. Okay, fine. Any other condition? Yes, constructive pericarditis or hypertrophic cardiomyopathy also. So what were our options? Left ventricular failure was an option. Mitral stenosis was also an option. But why mitral stenosis is not there? So you all know that after S1 there is an S2. Just after the S2, in case of a mitral stenosis is there, then the leaflets are no doubt closed a little bit late, but the opening snap is just after the S2. As soon as the S2 is finished, here there will be the opening step. It is not an S3, it is an opening snap of the mitral stenosis. So why aortic regurgitation is not there? So in the aortic regurgitation, we all know S2 sounds, yeah. In case of the S2 sound, which occurs because of the aortic and pulmonary closure. In case of the aortic regurgitation, this S2 sound is widened. We must understand that it is not the S3, but the S2 sound is widened, which is known as the decrescendo type of the murmur. So in the S2 there is a P2 and A2, and this A2 component is extended through the diastole, and that is the decrescendo type of a murmur in case of the aortic regurgitation, and it's not an S3. And in case of the atrial septal defect also, there is a wide splitting of the S2 sound. Means there will be the A2 and P2, and there is a huge gap. So the second heart sound is split in case of the atrial septal defect. So it's not an S3. So why all the other answers are not there? So in case of mitral stenosis, just after the S2 there is an opening snap. In case of the aortic regurgitation, there is a decrescendo type of the murmur in which there is A2 component is extended. In case of the ASD also, there is a wide splitting of the S2. So our only option in this question remaining is a left ventricular failure is the answer, right? So S3 heard. Why heard in this case is because left ventricular failure. So left ventricular failure will be there. It will result into the bilateral lower extremity edema also. And if the left ventricular failure is there, there is a reverse hypothesis. Left atrial, then there will be the pulmonary hypertension, as well as there will be fluid accumulation into the lungs, which will result into the shortness of the breath also. So reverse pressure hypothesis. And that's all about this MCQ. Thanks for listening.